The majority of people who are infected with coronavirus experience a mild or asymptomatic disease which can be treated at home. So if you're experiencing the telltale signs of the virus, what should you do to feel better? What are the symptoms? The symptoms of COVID-19, the disease caused by coronavirus, include fever, a temperature above 37.8 degrees Celsius or skin which feels hot to touch. A new, continuous cough. Shortness of breath and difficulty breathing. Fatigue. Headaches. Sore throat. Aches and pains. If you experience fever or a new continuous cough, you should self-isolate immediately. Those experiencing a mild illness don't need to seek medical attention. However, you should use the patient coronavirus checker tool again to find out what to do next if you cannot cope with your symptoms at home. Your condition gets worse. You still have fever, are feeling generally unwell or have other symptoms after a week. You are unable to do everyday tasks such as looking at your phone, reading or getting out of bed. Looking after yourself at home. As with other viruses such as colds and flu, taking it easy and looking after yourself are crucial to your recovery. You should drink plenty of fluids. Drink enough water so that your pee is a pale, clear color. Avoid alcohol as this will make you more dehydrated. Get plenty of rest. You should isolate yourself at home if you have any symptoms of coronavirus and avoid any strenuous activity whilst you are unwell. Medications. There is not currently a cure for COVID-19 or a vaccine against coronavirus. The aim of treatment is to manage and reduce symptoms until you have recovered. Most people, around 80%, have an asymptomatic or mild infection which can be treated at home. In this case, you should self-isolate for at least 1 week until you have recovered. 1 in 5 people who contract COVID-19 will require hospital care. Around 15% of cases experience a severe infection requiring oxygen to help with respiratory symptoms. 5% experience critical infections, requiring ventilation. Those at a higher risk of severe or critical infections include older people and those with underlying health conditions. Use over-the-counter medicines to treat some of your symptoms. Painkillers for most viral infections, including flu and the common cold. Simple painkillers such as paracetamol and NSAIDs, non-steroidal anti-inflammatory drugs, such as ibuprofen, are widely recommended. However, in a comment in March, France's health minister, Olivier Véran, claimed that NSAIDs could increase the risk of severe COVID-19 infection and complications. While it investigated the claims, the NHS recommended that people should avoid using NSAIDs if they had symptoms of COVID-19, although they could continue to take them if they were using them for other reasons such as arthritis. The UK's Commission on Human Medicines drew up an urgent expert working group to look at the evidence. On the 14th of April, they published guidance stating that there is currently insufficient evidence to establish a link between use of ibuprofen, or other non-steroidal anti-inflammatory drugs, NSAIDs, and susceptibility to contracting COVID-19 or the worsening of its symptoms. Patients can take paracetamol or ibuprofen when self-medicating for symptoms of COVID-19, such as fever and headache, and should follow NHS advice if they have any questions or if symptoms get worse. Other symptoms. Some of the medications and treatments you might use to treat colds and flu will also help with coronavirus symptoms. Cough medicines or cough suppressants can help reduce your cough. Throat lozenges and remedies like honey and lemon may improve a sore throat. Antibiotics. If you have antibiotics lying around at home, do not take them to treat coronavirus. As it is a virus, antibiotics will not improve coronavirus. You should never take antibiotics which haven't been prescribed for a certain condition. Antibacterial handwashes, unless they're also labeled as antiviral, cleaning products and hand sanitizers also won't be effective in killing the virus on surfaces or your hands for the same reasons. Traditional remedies. There are many natural cures and herbal remedy ideas floating around the internet and in health stores. Currently, we aren't aware of any remedy to cure COVID-19, so don't be fooled by the miracle treatments some people are trying to sell. Thank you for watching.